On behalf of Park DuValle, I'd like to welcome you to a special occasion, and that is the grand opening and ribbon cutting of our brand new location, which is Park DuValle Community Health Center at Newburg. This has been a long road to see it from cardboard into actually what it looks like. This facility will be providing a multitude of services from behavioral health to pediatrics to pharmacy to dental. It's kind of a one-stop shopping.
What an awesome occasion this is. Pray with me. Father God in heaven, we praise you and thank you for this glorious opportunity that we have.
Well, good afternoon. That was a warm welcome if I've ever heard. This is such a beautiful day, and this is a great occasion. You know, I want to welcome you and all the dignitaries. I first want to give thanks to Dave Garrett, Dave Arnold, Steve Weiser, Mr. Irvin, Ms. Johnson, and all the staff. I also want to give thanks to the board because they had a vision to bring Park DuValle further into Newburg. And then I want to give thanks to PNC for being able to provide us a loan for this location. And then last, I want to give thanks to my wife and my kids for letting me work countless hours into the night while they're asleep. So, Park DuValle is in 7 locations. A lot of people don't realize that. When we talk about health equity, a lot of people don't really understand what health equity is, and they describe it different. You know, health equity is the attainment of the highest level of health for all people. When inequities occur, such as when somebody doesn't have the opportunity to have access to health care, or they don't have the educational means, or they might be living in poverty. In 1967, that's where West End was at the time, and the ideal of having primary care in the West End began. Park DuValle is the oldest federally qualified health center in the state. We also provided the first ambulance service in the city because African Americans could not get to the hospital. Now, let's back up for a minute. If you have health equity issues, that means you have health inequity issues. That means you are dealing with issues with socioeconomic status, your environment, such as air pollution, which we mainly have a struggle in the West End. There's lack of education resources, which means kids will bus from one side of the town to the other side from 6 a.m. in the morning and then arrive to 7 p.m. at night. Then there's the income gap. If you look in most boardrooms now, it lacks minorities. You talk about diversity and inclusion, there shouldn't be a reason to talk about that. And let's talk about racism and discrimination. It occurs in healthcare, but remember, if they show up at our doors, that means something has happened along the way. If they show up in a hospital, that means they have been demoralized from being into the system of access, lack of housing, and the political power. So when we think about expanding Park DuValle, it's not the essence of providing health care, right? That is the end goal. It is a one-stop shop to provide care to anybody that walks through the door, regardless of income, regardless of status in life, and every facility should look pristine, right? But we have to look at not just the medical model of healthcare. We have to look at the upstream approach. How do we change the policies that brought us to this day? So I'm proud to say at any one of our facilities, our ideology is patient first. We have the dream team of diverse Wakanda staff, and we believe in a house of the mouse, which I have on my leg. That's what I look forward to in providing. So I want to thank you, and I'm going to turn it back over to Mr. Hurley.
was nothing extra.